Being involved in numerous organizations such as Dada and SeeChange.ie, she has been found participating in various projects, podcasts, and writing to spread awareness through empathy and education. And actually, last night I found out she's a nominee in the Black and Irish community for an award as well. So, introducing Blessing. So, welcome, Blessing.
Thank you so much for having me.
So tell us a little bit more about your journey to becoming a mental health advocate.
I suppose becoming an activist was kind of like an accident. I started off as a mental health advocate, just kind of due to my lived experiences of my upbringing. So a little bit about that. I'm born and raised in Dublin, Ireland. I am the eldest of 4 kids in my family, and my ethnicity would be Nigerian. So, there's that cultural conflict of growing up in a household with 2 different cultural backgrounds. My upbringing would be, the case of growing up around domestic violence and child abuse. And also going through a period of, being sick and, just bullying due to racism and being a little bit different. There was just like a lot of adverse childhood experiences going on there. And that would have an impact on your mental health. And at the time, I really didn't know what that was, or like what the term with what was going on with me. It was around the age of like between 12 and 14 that things continued to like get worse, and I was able to find a terminology around it. I remember it's like opening up about like struggling, and if you have an African mother, it's like, don't talk about mental health, I
was just going to say, so Blessing actually has quite a similar background to mine, in the sense that I'm also Nigerian born, and Nigerian in blood, born in South Africa. I'm also the eldest in my family of 6 kids, so lots of kids in my family too. And yes, I know very much well how that can be, talking about your mental health in a house that doesn't really understand what that even means, or that doesn't even consider mental health an issue.
Definitely. So. And we grew up with a very strong Christian background. When I opened up, it was just like, you're strong, and to pray it away, and there was just all sorts of different things that were said, and I never opened up about it again. And I remember just, being very young, up until the age of 15, just coping with my struggles of mental health through sports. And then, unfortunately, that had to stop because of just childhood sickness. And then I got better, and then I developed chronic illnesses after that, and then, has stayed with me since. Just growing up in Ireland, like, you would get speakers coming in and talking about mental health in school and mindfulness, and they were good, but because I didn't really see anyone that was speaking about these things that looked like me, I kind of internalized it as a me issue. And then the message was also conflicting, because school was telling you to open up, and then back home and your community was telling you that like, this is a Western society issue.
They were telling you to go to pray, and thinking prayer was the answer for everything, which we all know that, there is times where you have to ask yourself, do I need to speak to someone? Do I need to get professional help? Do I even need to take medication? All these things are important questions that a lot of the time isn't addressed in Black families and ethnic minorities.
Yeah. And then so like, during the teenage years, I lost 2 friends during that time. I lost one to suicide, and then I lost another one to chronic illness. And again, I just kind of internalized it. And then it just got to the point where like there's just so much stuff going on that I was just like, you know what, around the age of 15 or 16, I just started to kind of speak up within my community and with other friends on mental health. I was kind of like, I've already lost so much, what else could I lose by doing this, you know? And in the beginning, it was very, very difficult. Like, people within my own community were telling me not to talk about mental health, and there's just a lot of cultural stigma and shame. And it's been a very difficult and long journey, but, you know, fast forward to now, the conversation is getting a little bit better now. And, you know, I think there's just so much experiences that I've gone through to kind of use that to help other people. And that's all that matters, really.
So you've talked about, you know, sharing your journey and how that can help other people. But could you share more of some of your thoughts on engagement? For example, what do you think are the most effective ways to gather service users, family members, and supporters' feedback? Because in the end of the day, you know, we could all have these issues in mental health, but how do we give that feedback back to the people who can actually exert change?
Yeah, I suppose kind of meeting people at where they're at. So I think with like, for young people, for example, you're going to find them on social media, you're going to find them within mental health organisations such as Sea Change, Spun Out, Jigsaw, Lust for Life. Within like the ethnic minority community, you're going to find people, mostly, you know, especially the Black community, you're going to find them at church. And yeah, I think when it comes to like engagement, I think also kind of making it accessible, inclusivity, you know, making sure any type of research or survey disabled people are able to access it, blind, deaf, hard of reading, all that type of stuff.
Yeah, and one of the things I heard today is about including this more digital formats for these services. I think particularly for young people that would be very important, because a lot of our youth are online, either on Instagram, TikTok, whatever it is, and creating these platforms to be accessible to them digitally, and also factoring in different communities within the disabled community as well, making sure that they can access it as well is quite important. Now, do you have any thoughts on how giving feedback can ensure that there is service improvement?
I suppose with my experiences of taking part in surveys and giving feedback, I definitely think explaining the process of what the survey is about and making sure people are equipped with the full knowledge. And yeah, I definitely think a follow-up email or a call would definitely do, as people would definitely like to know what their information is done with, or if there's any updates. For me, I personally do that myself, you know, contact people for follow-ups and just kind of try to look out for any of the updates. But yeah, they would be the two big areas that I would say.
And we know that intersectionality plays a role in your and others' experience of mental health challenges and in seeking support. What can you add on to this, or can you speak to this?
Yeah, so for many people who don't know what intersectionality is, intersectionality is a term coined by Kimberly Crenshaw. She is a Black woman in the United States, and she is an educator, an activist, a writer, and she's many different things. And the reason why she coined the term in the first place was because she's an intersectional feminist, and she was raising awareness of the issues that Black women go through in the United States. But then she also realized that like there is also I suppose, the experiences of being black on top of being a woman, and how that can have a double, I suppose, effect of oppression in that sense. So intersectionality is kind of talking about the different ways we kind of exist in this world within our different identities, whether that's through race, gender, sex, disability, socioeconomic background, and how all these things can be factored into the impacts of our mental health, whether that's in a good way or a bad way, and how that can impact the way we access services and the way people treat us.
Okay, so do you feel like it not only affects how we deal with mental health, but also how people seek support when they're affected by this as well?
Yeah, definitely. Like, I remember the first time I reached out to my GP doctor experiencing chronic illness and mental health struggles. And there is just so much in the area of healthcare in general that needs to be decolonized and deconstructed, and many different myths that are out there that people still believe. So I remember that it was very hard. Women's health is not that great in general already, never mind being a black woman. And I remember just talking about the pain and the symptoms that I was going through, and just being told that like black people have a higher pain tolerance, and as a woman that you can push on and you're so strong. Whereas like you see that with like issues of like the cervical scandal check, and these things just need to be questioned and need to be challenged about why people hold such ideologies. And yeah, it's definitely medical racism exists. It's a very difficult experience to go through. But yeah, within that, there needs to be a lot of education and awareness.
So you have used your platform to voice the subject of mental health, and through this way you can be heard. And I know today we were speaking about how important it is to include our youth, to include the people that we actually are trying to support within all these conversations, because in the end of the day, they're the service users that we are targeting as well. So how does that feel to know that your voice can be heard in such way?
I feel like, I think back to 16-year-old me and how I was just so alone in the experiences that I was going through. Online, I connected to other young people that were in the UK and in the US, but obviously they don't have that like Irish experience. So yeah, I just want people to, know that they're not alone in the struggles that they go through, and to raise awareness of different issues that like ethnic minority communities will especially go through, such as issues of adultification and parentification, and model minority myths within the Asian community, being a first generation Black Irish to immigrant parents, and raising awareness of these topics that isn't often spoken about in mainstream media. And luckily I'm able to like connect with other people, because before then I was kind of like, is it just me experiencing this, or no one's really talking about it?
Well, I can tell you, it's not just you. Like you said, adultification and parentification, like that is something that is so real for me. Growing up, I became my mom and dad to my siblings, as well as their sister. So I nearly felt that I was the parent, the leader of the family. I was the adult before I even got to be a child. I'm actually going backwards now into becoming a child again and being able to do the things I actually want to do. But yeah, that tends to happen a lot within our community. So what changes have you been a part of in this world of mental health?
There's been a lot, especially within this past year. I think the most memorable involvement that I can think of at the moment is taking part in Mental Health Reform's 10th anniversary on the grassroots movement panel, and just talking about the changes that we wish to see in the Irish healthcare system. I also took part in their cost of waiting campaign for the budget that was released 2 weeks ago, and just kind of lobbying with politicians within the Leinster House a week prior to then. But I think the most important change is just seeing other Black and brown young people finding the courage to reach out to their community for help, reaching out to charities and mental health services for help. And even, Black Therapist Ireland came about 2 years ago, and it's a group of psychotherapists and other people in that profession who want to provide a space for Black people to know that there is therapists out there that look like them. So yeah, there's definitely been so many changes that have happened in the last few years, but especially in the last 2 years.
I think you're such a brilliant lady, and I'm sure you have many characteristics that you have possessed that brought you to where you are today. But if there is any that you feel that are so important in defining who you are as a person right now, what characteristics would they be?
I think empathy would be a big one, just because I often find when I'm speaking openly about my struggles of living with mental illnesses and the impact that has on me in so many different areas, it's not as easy as it looks like online, because talking about your mental health online, it's more than just quirky Instagram posts.
You're being vulnerable. You're opening a very, very vulnerable part of yourself to people. So that's so brave to be able to even do that, especially on a huge digital platform. So
definitely, and sometimes you do often get, you don't often get the support that you need, and at the end of the day, you just have to remind people that sometimes it's just down to a lack of education. And just lack of empathy, and just to give people the time and courage and patience to kind of get there in the end.
If there is one piece of advice to a service user or a family member or carer that you would give, what would it be?
I would say to go where you're celebrated and not where you're tolerated. And I know people are so sick of me saying that all the time online, but it's just because family and community is just really important in trying to recover in your mental health. And unfortunately, when it comes to my situation, I have lost family from living with mental illnesses and speaking openly about it online, and I have lost friends and opportunities and that type of stuff. But at the same time, you will find people who are understanding and have similar morals and values, and are just really passionate about collective liberation and radical change. So yeah, it's really important to just stay your authentic self.
Yeah, no, I love that quote at the end. So thank you so much, Blessing.